Friends, welcome to the channel. I am Ashish and in this video I will be teaching about the topic Micturition. So if we talk from the examination point of view, this is usually asked as short note in physiology in the MBBS first year. So I will be telling you about the three different headings in the topic of the Micturition. The three subheadings that we are discussing is what is Micturition, how Micturition reflex is started or generated, and the clinical cases or the clinical associated with the topic of the Micturition. So let's first start with the definition of the micturition. So here we have a very good definition for micturition, that it is a process by which urine is voided from the bladder. So I would like to add a note to the topic or the definition that it is a reflex process. Micturition is a reflex process by which urine is voided or from the bladder or the bladder is emptied. So there is various steps that occurs during the process of micturition that leads to the emptying of the urinary bladder. First of all, before understanding the topic of the micturition, you have a good idea of the nerve supply of the urinary bladder, the inner or the internal urethral sphincter and the external urethral sphincter. So I will give you just brief introduction to it. The detailed video is already uploaded on my channel. Please check out the video section and there will get the detailed video of the blood supply and the nerve supply, including different anatomy of the urinary bladder that we have already discussed. So the primary discussion is about the nerve supply of the urinary bladder and the urethra, especially about the urethral sphincters. So here is the urinary bladder. Here in the urinary bladder we have a specialized muscle called the detrusal muscle, and here we have the internal urethral sphincter and here is the external urethral sphincter. See, external urethral sphincter is under the voluntary control. So what do you understand by the voluntary control and the nerve relation? So if something is under the voluntary control, it must be supplied by the somatic nerve. So the somatic nerve in this case is the pudendal nerve. Pudendal nerve. So pudendal nerve supplies the somatic nerve, or carries the somatic sensation from the external urethral sphincter. The internal urethral sphincter is supplied both by parasympathetic and the sympathetic nerve, and the detrusor muscle is also supplied by both parasympathetic and the sympathetic nerve. See, suppose the parasympathetic part is called the parasympathetic is also called the craniosacral outflow. So it will arise from the either the cranial part or the sacral part. In this region, in this question or this particular topic, the origin of the parasympathetic fibers are from S2, S3 and S4. So the parasympathetic fibers arise from the S2, S3 and S4, and the sympathetic part is also called the craniosacral is for the parasympathetic and thoracolumbar is for the sympathetic. So it will arise from the lumbar region, in this case L1 and L2. Here we have the sympathetic part. So this supplies both the detrusor muscle and the internal urethral sphincter. So as well as parasympathetic also supply the detrusor muscle as well as the internal urethral sphincter. The detailed video is already uploaded. Please kindly check out on that. See, now we have to understand the work of all these three types of nerve innervation to the urinary bladder and the sphincters. So the parasympathetic helps in the emptying of the urinary bladder, or you can, here is some mnemonic to remember the function of parasympathetic and sympathetic. Parasympathetic promote micturition and sympathetic stop micturition. So for the micturition process to occur, the urinary bladder must contract and both the sphincters must relax. So the parasympathetic part does the work of contraction of the detrusor muscle and the relaxation of the internal urethral sphincter. The somatic nerves carries the pudendal nerve controls the external urethral sphincter, that is under voluntary control. So we have to discuss, when discussing sympathetic and the parasympathetic, we have to discuss the supply to the bladder, that is the detrusor muscle, and the internal urethral sphincter. So parasympathetic promotes micturition. For that it should contract the urinary bladder or the detrusor muscle and relax the internal urethral sphincter. Opposite will occur in the case of sympathetic. Sympathetic stops micturition. So S for sympathetic, S for stops. Sympathetic will carry out the process of the filling of the bladder. That means it will relax the detrusor muscle and it will close the internal urethral sphincter. I hope you are now quite aware of the different function done by the sympathetic, parasympathetic and the pudendal nerve. Now let's see the different topics under the heading of the micturition reflex. We are going to draw a flow chart for the easily remembering the micturition reflex and the various steps occurring in this reflex process. So let's start with the micturition reflex. So micturition, first you have to decide when the micturition reflex will start. For that you should know about the capacity of the bladder and generally what is the normal level of the bladder filling and when the reflex or the micturition reflexes started or began. See, the normal capacity of bladder ranges from 120 to 320 ml and the average will be around 220 ml. So till 220 ml is the normal capacity of the bladder, but it can be expanded further till 500 ml. See, 220 ml is the normal filling of the bladder, but when it increases from 220 to 300 to 400 ml, the process of micturition or the micturition reflex starts. It can be controlled, the micturition can be controlled up to 500 ml, but beyond that it becomes totally involuntary. So up to 500 ml micturition can be controlled, and above beyond 500 the complete process becomes involuntary. See, the whole process, the only the controllable part is the external urethral sphincter. Internal urethral sphincter is not under our control. So when I say up to 500 ml it is voluntary, means we are able to control the somatic nerve innervation or the external urethral sphincter. So this was about the general volume or the filling of the bladder. Now when the micturition reflex starts, when bladder volume increases, when bladder volume increase. So when this volume will increase or it will exert pressure when the volume is around 300 to 400 ml. So it will stimulate the stretch receptors. It will stimulate stretch receptors. So let me tell you, there are multiple stretch receptors present along the walls of the bladder that carry the sensory innervation from the bladder to the sacral part of the spinal cord. So they stimulate the stretch receptor. So the sensory nerve or the sensory innervation via pelvic nerve. So the sensory impulses from these stretch receptors will go to sensory impulses go to sacral segments of spinal cord. Via which nerve? Via pelvic nerve. Okay, sensory impulses will go to the sacral segments of the spinal cord via the pelvic nerve, and from the sympathetic, see, as you know, spinal cord has dorsal and a ventral horn. See, sensory part is the function of the dorsal horn because here is the presence of sensory pseudoganglion on the dorsal part. So from the dorsal part of the spinal cord of the sacral segments, the sensory impulses will arrive. See, the spinal cord is under the control of the higher centers from the cerebrum and the midbrain and pons that I will tell you in the later part of this video. So they, from the dorsal part of the spinal cord, especially the sacral segments, the sensory impulses arrive, and from the anterior horn the motor impulses will go on. So from the sacral segments of the spinal cord, motor impulses will be generated. So what is the function of this motor impulses? Actually the micturition reflex is the function of the parasympathetic part. Okay, so this from the S2, S3 and S4 segments, the motor impulses will arise and they will do the work of the contraction of bladder and relaxation of internal urethral sphincter. IUS means internal urethral sphincter. Please write the complete full form in your notes. So as soon as the internal urethral sphincter will relax, means this gate will open. So the urine will now enter the urethra. So as soon as the urine will start entering the urethra will expand and the stretch receptors of the urethra will be stimulated. Entry of urine in urethra. So this will cause the stimulation of stretch receptors. So what will happen when this stretch receptors present in the urethra will be stimulated? This will again go to the spinal cord. So the sensory impulses from the stretch receptor will go to the spinal cord, especially the sacral segments, and inhibit pudendal nerve. Why? Because we have to open this outer gate. So this will inhibit the pudendal nerve. So when pudendal nerve will be inhibited, this gate will open, means external urethral sphincter open or relax, leading to the voiding of urine. So this is how the micturition reflex occurs. So you can see, as it is a reflex process. What happens in reflex process? We have three components. One sensory fibers, one is the control center, other is the motor fibers. And the micturition reflex is self-regenerative. What I mean when I say self-regenerative means when the initial contraction will start in the bladder, it will again cause the stimulation of the other stretch receptor and further increase in the contraction and the aiding in the process of the micturition. Micturition is also aided or promoted by the pressure of the abdomen. As I told you, micturition reflex is also controlled by some higher centers. So which higher centers? Higher center can promote also and inhibit the micturition process. So let's see, first discuss about the higher centers which promote micturition, and the higher centers which inhibit micturition process, So the higher centers which promote micturition or facilitate micturition includes the pons and part of cerebral cortex. So the exact part of the cerebral cortex is not yet known, but you can mention pons. Pons promote the micturition process when midbrain inhibit the micturition process along with the some part of the cerebral cortex. So like this we complete about the topic of the heading or the definition of micturition and the micturition reflex. Now let's see about some clinical cases or the applied physiology of the micturition process. There are three clinical or applied related to the micturition process, that are the atonic bladder, automatic bladder and the nocturnal micturition. So let me tell you about each of them one by one. Just you have to listen carefully. What happens in the atonic bladder? As the name suggests, there is a loss of tone of the urinary bladder. Why it happens? It is due to the destruction of the sensory nerve fibers of the urinary bladder. So if there is a destruction in the sensory nerve fibers, the stretch receptors will not work and they will not carry sensation of the stretch or the increase in pressure of the bladder to the spinal cord, and therefore they will not any contraction of the bladder. So the tone of the bladder is lost in the case of the atonic bladder. So when are the cases of situation you can see the atonic bladder? See, the very important cases is the tapes dorsalis. Tapes dorsalis occurs in the tertiary case of the infection of the syphilis. So what happened in the tapes dorsalis? There is a destruction of the dorsal part of the spinal cord. So when happens destruction of the dorsal part of the spinal cord happens, the sensory impulses will not be perceived and therefore the stretch receptor sensation will not reach the spinal cord, leading to the decrease in the tone of the urinary bladder. So this happens in the atonic bladder. When I say the automatic bladder, it should clearly come to mind that the bladder, the process of micturition is hyperactive in this case. So when the small amount of urine will enter the bladder, it will cause the stimulation of the stretch receptors and the process of micturition will be started. So what happens in the automatic bladder? Hyperactive. What happens? Hyperactive micturition. So how you can define the automatic bladder in just one word? It is by the hyperactive micturition reflex. In this case, the voluntary control is the lost. And what happens in nocturnal micturition? It is commonly seen in children of less than 3 years of age. So what happens in the children of less than 3 years of age? It is also called bedwetting. Nocturnal micturition is also called bedwetting. So what happens in the children of less than 3 years of age? The myelination of the pudendal nerve has not been occurred. When the myelination is incomplete, the nerve impulses cannot be perceived or carried from that particular nerve which is unmyelinated. So there is loss of the voluntary control and the micturition occurs. So there is the not complete myelination of the motor nerve fibers in case of the nocturnal micturition. So this was all about the applied related to the topic of the micturition. If you like the video, please hit the like button and do subscribe to our channel. Thanks for watching.